We've been working for 10 good months, no salary. Personally, my rent expired in 15th August. I've not been able to pay. My landlord is always asking, when are you paying? I'll be like, they'll pay us, please give me time. I stay at Pantine. I wake up for Lebu. I take transportation, 42 cities to work every day. How do they expect me to get that money to come to work?
Hello and welcome to another edition of Trends on Rap Daily Focus. You know how we do it. I'm Benita Swatson and I'm going to be your host for today. So straight into our first dab. The coalition of unpaid nurses and midwives have hit the streets of Accra to send a petition to Ministry of Health and the Minister of Finance over unpaid salary for 10 months. This issue, anytime I start talking about it, I get emotional because if you have been there before, you'd understand what is going on. It is no joke. It is not something to laugh about. To work and then not get paid for 10 months, how would you cope? Your fare, how would you eat, your clothes? Let's go listen to some of the nurses lamenting over the issue.
Damn! Is this the change we voted for? Is this the change we voted for? I can't do. Abba, ya
Ghana father, I am with tea and nurses for your blessing. Ghana for Musario, President Mama, Stia Sufio, ya bro, ya Ghana for Bima, Midnight, Mindy.
Meant to pay us. We've been working for 10 good months, no salary. Personally, my rent expired in 15th August. I've not been able to pay. My landlord is always asking, when are you paying? I'll be like, they'll pay us, please give me time. I stay at Pantine. I wake up for Lebu. I take transportation, 42 cities to work every day. How do they expect me to get that money to come to work?
You know, it is so sad that a country as old as Ghana is still faced with challenges like this. Because how would you expect somebody to be working and then no source of motivation? Salary is actually a source of motivation if you don't know. And so if somebody is working with no source of motivation, the person is not encouraged in what he or she is doing. Let's listen to one of the nurses saying that she had to cut her hair because she didn't have money to braid or even wash.
Oh, Yanti, Makocha Miti, Makocha Miti, Ade.
That's a real fatal.
Yakasma, Fatame. Anya Yakami Kocha. Anya, you can read a good to Kamikocha, mini washing sick and Makocha, mini bread sick and Makocha, mini bone shade sick and Makocha, Ade. Money man,
Where do you work?
Chinyani Teaching Hospital, Bono.
If I'm out in a deal call.
No, Western Ridge in Takwa. Bono, 8 hours distance.
That means you're renting hobby.
I'm renting. I'm paying all the bills.
Issues. There was one nurse who also said that he doesn't go to the hospital to dress his wound because he didn't get money to buy his medications after surgery. Like, there's no provision for nurses to be taken care of even if they are sick, and yet their salary has been held. And so how does this particular person get to buy medications for himself? And then if he is the beneficiary of the family, how is he supposed to take care of them?
So, I say, Juma 10 months, now in Chiayaka. Me, I make a say, I am operation last month, as you see a chrono, and that's one a chrono. The pains near there me go through no. For working for 10 months, I am Chiameka, in Raya Trema, I'm toy. To me, person, me busa say, I am Bonnie, my nurse ni Anna. Is it a crime to be a nurse in the country? If it is a crime, our leaders should let us know. Because me a health worker, me yaro coming to me, in Raya Trama, me to me, and the Bonnie Namayana, one country.
Now, is there no system within the health sector? Nurses, more say, be a more area, it will take care of you.
There's nothing. As a nurse, because I will yare with mama. Para, you have to pay. I was so quite to say, but there's no system in Ghana health service. Me operation I'm calling, I pay 3,500 cedis. 35 million. Me entry me can make a board besia and the bedroom me disabled. Me papa is disabled. It me ko board besia 3,500 and I'm the drugs prescribe my mintimin kotoy. I was send me ye daily wound dressing. There be me come here micro. Mintimin come here because mintimin to on your mano. It me born in some year next niana.
Wow, so how have you been coping? One of your boy my operation when you know.
May some of my colleagues in the any senior staff in Guamu and the one man normal contribute to the big akana or more the abuame. Or more than me depending on them. Aside them, no, I don't have any hope.
So where were you posted? You posted where?
Ashanti region.
But I find an chance in your posted.
Me was Ashanti region, but now me walk in Pasaso. And you posted me call different districts. And baby, I'm a coin. No, I don't have any family member there. It's on me high dying. Mutual light bay. And then 3 days, and ECG able to me fuse. So, am I disconnecting my lights input? What are the eba? It's me rent or any night challenges that me go through. Even feeding crown is even a headache because the operation now my and yet was a midi. But because I'm not having that financial strength, no, I don't have any option. Now that I'm here and the pains I me go through, no,
it's sad though, very sad. You know, I've been to sad situations before and I must say it has not been easy. You know, sometimes somebody will sit somewhere and be like, oh, na so obetimi ejaye jumani. Yes, obetimi ejaye. But then if you quit, your money is not coming to you. And then if you stay too, you're not getting motivated. So what is the next step? I think that this is something that the minister and Ministry of Health should look into. This is very sad. It is very, very, very sad. So we are pleading with the Ministry of Finance and the Minister of Health to please and please and please do something about it. Because
I have been a member of parliament and I'm still a member of parliament from a rural constituency. So I have constituents who are going through the same ordeal. I have family members who are going through the same ordeal. But not yourself. The truth of the matter is that we inherited 13,500 of you being recruited without any financial provision. Please listen to me carefully. Now, as I speak to you now, we have collaborated with the Ministry of Finance. And please listen carefully. When it comes to issues of salary, the Ministry of Health then collaborates with the Ministry of Finance. Now, out of the 13,500 people, more than 7,000 to 8,000 of them have been processed and they are receiving salaries. It's not true. Now, we have about 6,500 of you whose documentations are still being processed. What I can tell you on authority is that we appreciate the challenges you are going through, but we as a Ministry of Health will continue to work closely with the Ministry of Finance until all of you are paid. And so I have heard a lot of you screaming when. With the greatest of respect, allow me to get back to my colleague, the Minister for Finance. Let's put our heads together so that we can give you the final, deadline. I do not want to stand here and give you a timeline, say next week, and when it's not being fulfilled, it will be construed as we have also, disappointed you again. I know you are going through a lot, But with the greatest of respect, please bear with us. Please bear with us. We will continue to work closely with the Ministry of Finance until each and every.
This is so sad, and it's a pity. It's a pity for a country as Ghana to have such issues. This is very bad, and we are pleading with the minister to do something about it. And that is it for today. Until our next story drops, it's a goodbye. Please don't forget to follow, like, comment, subscribe, and hit the notification button so you never miss an update. As usual, I am your host, Benita Swatson. Bye.